Have you ever heard of the term autoimmune disease? Autoimmune disease means it's a disease that affects one's own self. That is, your own body treats you as foreign or an outsider and it attacks various parts of the body. Some of them might be your joints, it could be your kidneys, it could be the eyes, the lungs, nerves, skin, any part of the body. One of the commonest autoimmune diseases that we rheumatologists see is called lupus. I'm not sure how many of you have ever heard of this term called lupus, but we do see this very often in the rheumatology OPD. When do we think of lupus or when do we suspect lupus in a patient? If there's a young lady who comes to us with joint pains, joint swelling, a rash, particularly in the sun-exposed areas. So she might have gone to the beach, she might have gone out in the sun, and you could notice a particular rash that involves her bridge of the nose and the cheeks. This is we call it as butterfly rash in our medical terms, or it could be any other sun-exposed areas like the chest, the back, or the limbs. So a rash there. Sometimes mouth ulcers that do not heal with conventional treatment or usual treatment. Profound loss of hair, bald patches on the scalp, and many other symptoms. So when such people have recurrent episodes of fever that are not due to infections, we suspect lupus. There are many clues for a rheumatologist to suspect lupus in a person who comes with these symptoms. And some of these blood tests could be as basic as a blood count, because patients could have a low white cell count or platelet count or low hemoglobin, or they could be, depending on what other organ the disease affects, could show up on the relevant tests. There are some blood tests we do to confirm a diagnosis of lupus. Why is it important to recognize lupus? It's important because in India, it is said that at least 60% of lupus women during their lifetime will have the disease affecting their kidneys at some stage. It is very important for a lupus patient to be always under the care of a rheumatologist, mostly because it is important for the rheumatologist to examine them periodically, do certain simple blood tests like a blood count or a urine test to ensure their blood cells and kidneys are fine, and to ensure that lupus has not involved any other organ in the body. It is important to recognize these body part involvements much early, because if you don't, particularly in organs like kidneys, if it relentlessly progresses without any symptoms, it could reach a stage where you might have damaged the kidney before it is brought to medical notice. Early diagnosis is the key. There are plenty of modern treatments that are available to treat diseases like lupus, and treating them would eventually improve a patient's condition, their lifespan, as well as prevent organ damage. Hence, any young person who has repeated fevers, hair loss, any rash on the body that gets worse with sunlight exposure, joint pains, mouth ulcers that don't heal, and low blood counts, one has to think of lupus. And this is a message that I would wish to give to not just patients, but even colleague medical professionals.